AI-powered smartphone fundus camera, advancing, referable and screening.
Yeah, good afternoon. So I'll be talking about in a scenario where we have an increasing aging population, the burden of AMD is going to increase further. So we need a good screening strategy. So with that in mind, the purpose of this study was to evaluate the performance of a novel AI-based device which was implanted on a portable smartphone-based fundus camera to detect its ability to pick up referable AMD. It was a single-center cross-sectional study conducted in patients over 40 years of age with suspected AMD, and the device in question was this non-mediatic Remedio fundus on phone device, as you can see here, no financial interest. So the AI algorithm was developed by training the software with using over 100,000 images obtained from the ARET study, and subsequently on a smaller set of Indian eyes it was validated. So this is the device, as you can see, it takes a non-mediatic fundus photo, and then the software runs and gives you a reading that whether it's a referable AMD or not. So the study flow was like the patients underwent the imaging by this device, and the software told whether it was referable or non-referable AMD. All these patients also underwent detailed clinical dilated fundus examination, fundus photography with Claris, and an OCT line scan. Then independently, 3 retina consultants in a blinded manner graded these images, and the combined grading using the OCT and the fundus picture was taken as the final gold standard against which the performance of the device was compared. So this was the ARETS classification that we used, no AMD, early, intermediate and advanced AMD. The intermediate and advanced AMD were considered as referable AMD, and the earlier categories were considered as non-referable. And combining both the OCT and the fundus imaging, the consensus grading of final AMD grading was arrived at using the same ARETS nomenclature. So as you can see in the results, we had around 490 patients with a mean age of 62, and in the total of 256 referable AMDs, the software correctly identified 233 of them. What is more impressive was in the advanced AMD category, 171 out of 178 referable AMDs were picked up, which is like nearly more than 96%. And there was a good intergrader agreement between the 3 graders, especially when using combined grading compared to when using fundus grading alone. So, and among the false positives, among 233 non-referable AMD cases, about 34 were falsely flagged as referable, but most of them had early AMD compared to no AMD. So as you can see, the sensitivity and specificity of the device was 90% and 85% respectively, with the overall diagnostic accuracy of 88%. The majority of false negatives were intermediate AMD, and very few advanced AMDs were missed, and majority of false positives were at least early AMD, and very few non-AMDs were referred as true AMD, referable AMDs. So these are some of the examples of the images. You can see some true positives where a CNVM and an intermediate AMD was correctly identified, some false positives where a no AMD or an early AMD was falsely flagged, true negatives, and a false negative here where you can see some intermediate AMD being missed by the device. So to discussion, the diagnostic accuracy of this software was similar to other AMD algorithms reported in literature, and the strength of this study was it was a prospective study on a large number of cases, and it is an offline AI which can be integrated into a smartphone based fundus camera, and the next step would be to validate it in a more widespread population based scenario where we get the true idea of prevalence and the screening. So to conclude, it is a novel offline AI integrated on a smartphone fundus camera, and it has a potential to make AMD screening accessible, affordable and effective for all. Thank you.
How much was the sensitivity in the early AMD group?
Sir, so the device was trained only to pick up referable versus non-referable. But if you ask me, overall its ability to pick up any AMD was about 84%.
Because according to your data, a lot of findings are missed in the early and intermediate.
Yeah,
they are the patients who require early referral and treatment. Advanced AMD anyway, I think.
So referable AMD was classified as intermediate or advanced. So it's only early and no AMD cases which were non-referable. Intermediate and advanced were referable.
Who's the company?
Remedio, sir, Remedio.
No. software, AI software?
So they have only collaborated and with the US company, and they have developed the software.
Because I saw a large number of IRATs.
Yes, yes. So
patients
we took
incorporated.
permission from them, and we analyzed they analyzed the images with the trained the software. Then they analyze in different centers in Bangalore and others on Indian patients. And once it was validated, then the study came to our center, where we tested it with the gold standard of 3 retina consultants to validate whether this applies to our patients or not. So we did the last part of the study. The initial part was already done by the company and the.
This study assumes importance in view of the fact that all our efforts are directed towards DR screening.
Yes, sir.
If this can be combined with AMD screening, as
Yes.
we are doing since a long time.
And it's a portable, non-mediatic device, and it's offline AI, sir. So it does not need internet connectivity. Once it's deployed, it can be used.
Thank you.
Thank you, sir.